Well, first, let me express all of our thanks to Healthy Minds Canada for this initiative and, spearheading the conversation on workplace mental health. I think you'll hear as we get started into the conversation, we all have some different perspectives on it, but all agree that this is a really important conversation to have that can have really positive transformational impact in your workplaces, both at the individual level and at the organizational level. We're going to get started just by introducing ourselves, and I will take the lead. So I'm Jodi Butts. I am the Executive Director of Rise Asset Development, which is a social enterprise which works with people with a history of mental health and addiction challenges, and we support them in starting businesses through low-interest small business loans, free training, and mentorship. I come from traditional healthcare previous to my role at Rise, and I'm also a lawyer by training. So maybe if we can start to my left, and you'll get to hear about the way more learned panelists.
Hi everyone, I'm Gina Giulio, and I'm the clinical psychologist and clinical director of psychology at the Medcan clinic. I've been there for 5 years. Prior to that, I was working at the Markham Stouffville Hospital, so I have some community hospital experience. And prior to that was in Ottawa at the Royal Ottawa Mental Health Centre, where I worked in both the mood and anxiety programs, in the inpatient and outpatient programs.
Hi everyone, my name is Sarah Lindsay. I was diagnosed with a chronic mental health issue, a mood disorder, in 2005 when I was still in high school. And since then, I have gone through a university degree. I worked for a number of years in communications in Ottawa in the political sphere. And then when I moved back here, I went into PR communications here in Toronto. And about a year ago, I had a major relapse of my illness, and so I left work, and I had been on disability since April of last year. And then this year, I joined the Rise Asset Development Youth Entrepreneurship Program. It's a mouthful. And I began to build a business around mental health in the workplace, based on the fact that I have the other half of the conversation. I have been the employee with the mental health issue at work. So when employers need to figure out how to talk to someone, what to say, I'm not coming from a legal or a clinical background, but more of a human experience. What are your employees actually feeling background? So yeah, that's me.
Good afternoon. My name is Janet Ozembloski. I am working with the Medcan clinic, where I am their in-house counsel and their privacy officer. I previously to Medcan worked both as a litigation lawyer and in the insurance industry, managing litigation with a heavy background in employment law. Everything I've always done has been involving difficult conversations, so this is nothing new to me, but helping employees and working with people to bring about healthier workplaces has always been my personal passion as a lawyer, and I've been very fortunate at Medcan to be able to take that passion and work with people every day who work towards healthier workplaces, both physically and mentally. And so I look forward to this panel.
Good afternoon. My name is Loretta Brill, and I partner with a firm called Nxknowledge Corporation. The last number of years, we've been doing a lot of work in the area of organizational change, strategy work, and in the last, I'd say, 5 years, I've gotten involved with the area of mental health in the workplace. And so how do organizations start to have and continue to have the conversation that needs to be had? My passion is really around people speaking up, and people speaking those undiscussables, the ones that we tend not to talk about. And mental health is, in the last few years, has certainly been that. I think it's kind of the latest taboo. It's not the last one, but it's so we do a lot of work with organizations, with managers, with senior managers to help them equip themselves with the tools and the confidence to have the conversations and build the strategies they need.
Thank you very much. So as you can see, I'm joined by some really learned individuals on this topic. I am going to kick it off with a question. So I saw some of the framing around the workplace mental health conversation is that it's a tough conversation. So I wanted to ask my fellow panelists and maybe ask you, Janet, to get us started. Why is this a tough conversation?
A tough question. I think there's one answer that I've always found resurfaces when this comes up, and I think it's a tough conversation because mental illness is a difficult concept for people to grasp. When people have traditional illnesses such as cancer, when they have traditional disabilities, whether they be in a wheelchair or need other accommodations, we can all generally get our heads around that. We can say A to Z, here's what that person may need to get better, or that's the path they're going to take. Mental illness is not something for the untrained person, unlike Dr. Giulio, who would have that training. For most of us, we don't really know what it is. We may hear terminology around mental illness, but it's something we just can't fully understand without that training. And so I think that's why it's a difficult conversation. People don't like to talk about things they don't really understand.
I think one of the other reasons in terms of the folks that we talk to in organizations, and this is small and large organizations, private and public sector, people, again, to really reinforce what Janet's saying about people just don't know, and what we don't know, especially as managers, we just don't like to, we're not comfortable talking about it. But I think the other thing is around the aspect of, if I do talk about it, is there more work I'm going to get? And quite frankly, I'm so overwhelmed right now with the work that I have. Now we're going to add something new to this. People really struggle with that. And so I think that's another piece. I think the stigma is another huge issue. There's been lots of conversation about that in terms of what is this about? And while I catch it, you know, we've actually had people speak to that, like that, in terms of having that conversation.
Sarah, can I impose on you to provide us with that
Yes.
employee perspective?
Yeah, whenever I speak to people about this, or my people in my own life, or I was speaking to some college students about this who are taking a public administration course, so moving into being administrators, I had someone say to me, you know, there's all these issues that we've been told in the last few years that we have to be very sensitive about. Gender, diversity, big conversation now is the trans conversation. And he just seemed very afraid that he was going to hurt somebody's feelings. And so it's this fear that we hear all the time when you open up this conversation is, yeah, but what do I say? Well, I can't tell you what to say because every experience of mental illness is very private and very different from person to person. So I think the way to start is to just not say much at all. You know, maybe ask your colleague or your friend, you don't seem yourself. Are you okay? And then just shut up. You don't have to say much, just acknowledging that you've noticed there's a change in someone, and the acknowledgement itself is actually a sign of caring. It's a sign that you've noticed someone that you spend 40 hours or more of your life with every week. There's a change, and it's not a positive, it's not a negative, it's just an acknowledgement that someone in your life doesn't see themselves, and that's actually much more powerful to someone who thinks they're struggling alone and thinks no one sees their pain. Just the acknowledgement is far more powerful than I think a lot of people realize. So, yeah.
Add to that, on the employee side, I think one of the greatest barriers, of course, to having the conversation is still this concept of stigma. When I work with clients, it often takes me several sessions just to get them or to encourage them to speak to their employer about their mental health status. 20% of people at any given time have an identifiable mental health condition. Of those 20, the Canadian Mental Health Association just released this statistic. Of those 20%, only 23% are willing or would feel comfortable speaking to their employer about how they're feeling, about how their condition is impacting their ability to do their work. So stigma still remains the #1 barrier to having the conversation. And what I hear the most from my patients is that they worry that they're going to be perceived negatively by their employer, that divulging their mental illness might lead to them being fired or to some kind of dismissal, down the road. So stigma is still huge. I mean, we're making great strides in that regard, but we still have a lot of work to do in order to reduce stigma, to help further facilitate the conversation.
So some really great perspectives here. Really, that in part there's this concern around sensitivity, actually not wanting to say the wrong thing. And so sometimes people will default to saying nothing. There's the concern around stigma on the part of the employee. And that, can prevent having a conversation, and that sense of the unknown, right? Like, so for so many people, even though statistically we must all know somebody who has a mental illness or an addiction challenge, right? 1 in 5, everyone in this room knows somebody. And yet there's still so much unknown around it, and that stigma, can prevent, these healthy conversations. So let's talk a little bit about. So let's say you get over this hurdle, right? And you ask that question, as you suggested, Sarah, like, how are you? I couldn't help but observe that there seems to be a change in your behavior or how things are going. Are you okay? Let's give some really practical advice about how to have that conversation. So open questions, listening. What else is important?
I think even before you go into the conversation, one of the things that we talk about with our clients is in coaching with them is to really become clear about their own yeah buts. And so their own kind of perspective, their perception, their own mental models that they have around what's going on. And so this neutrality that you were talking about, Sarah, is a really difficult thing for people to get their heads around. This is not about being good or bad. This is just about an observation. And we always encourage them to look at what their intention is. So what do you really want from this conversation? Is it really just opening it up to understand? And so this idea around understanding becomes so important. So that's the very first thing in terms of what are your yeah buts and what are your intention, and how are you going to physically set this up? Is it going to be in a crowded area in the office? Is it going to be in the morning, so if the person's upset from the conversation, they have the whole day at work? So those kind of pragmatic things become important too. That's the first thing that we talk about.
Leading right off that is this idea that when you are asking someone, especially a colleague who you have this professional relationship about, as soon as you open up a conversation about mental health as opposed to a mental illness, like a mental illness is a diagnosis, but a mental health, we all have mental health. And at different points in our life due to stress, it's either positive or it's suffering, just like your physical health can be great, or you can have a terrible flu and it's suffering. So when you start to talk to someone, a professional colleague, and you point out that you have noticed they are suffering, you're entering a personal realm. You're entering their personal world. You're asking them about emotions and thoughts that are so inside their own head. You've already crossed a line. So you don't want to cross a line sitting behind your big boss desk in a very cold environment. It might be very beneficial to just come up to the person and say, hey, do you want to get a coffee? Do you want to leave this professional environment? Or if it's a beautiful summer day, you want to go for a walk? So you're outside of it. We were saying before, another employee is not going to knock on the door and interrupt this very personal conversation. You leave a bit of a authority and not environment. It's more just two people having that initial conversation. Now down the road, talking about If the person needs time off or accommodations, whatever it might be, that needs to be more official. But just in that initial interaction, it's good to take out the power dynamics a little bit, if you can.
Janet, can you talk to us a little bit about when to have this conversation?
I think there are two scenarios, and we've been touching on both of them throughout this discussion. There's one, the employee decides that they are going to speak to someone in the employment, whether they're manager or someone else, or there's a discussion where someone in management or a colleague sees that someone's not themselves for whatever reason. So there's two different ways it can start. I think when the employee comes to someone in HR or someone to talk about it, it's a little bit easier because they've already decided in their mind, they've gotten to that point where, okay, I've gotten over the hurdle of the stigma, I'm going to go and talk to someone. That's a bit easier for the employer. I think I find in my practice, I've seen it's harder for the employer to know when to go and initiate that conversation. And the way you need to look at it is to always understand fundamentally from a legal perspective, there's a duty to accommodate. And I bring in the metaphor with people I've worked with that an employer in an employment relationship is like a family now. We are no longer in an era where people come in, they do their job, they go home, and the private and the workplace are completely disembodied entities. No, everything comes together now. And an employer no longer can cast a blind eye, and if someone's not working out, just fire them. That's not going to happen. The case law, and we could spend hours on that, we won't. It's very clear that we live in a very caring society that's embraced the notion that there is a duty to accommodate, and the only time you stop accommodating that employee is at the point where you get to undue hardship. And there's a lot that can be done, and there's a lot expected of employers these days before they get to undue hardship. So in terms of when to start the discussion, I would always give advice that earlier the better, because often people say, well, they've missed a couple of days, they come back, it's okay. But as soon as you start to see a pattern where you have that sixth sense, and sixth sense is very powerful, that something is just not going right in that person's world, they're missing too much, they're not being their usual attentive, lots of mistakes are being made, they're being tempestuous, one could go through 100 different scenarios. It's time to have that discussion, and I think the most important decision is deciding who's going to have that discussion. It's a very unique discussion, and you need, as an employer, to choose probably the most sensitive, informed individual in your organization. It might not necessarily be the direct manager, because there are times when your direct manager just may not have that emotional intelligence to have such a difficult discussion. And if you, as someone even above that manager, knows that that person just may not have that sensitivity level, you want to choose someone who does. And again, being the legal perspective here, you don't want things to go down where they get to legal proceedings, because that never goes well. Nobody wants to be in litigation. Nobody wants a complaint before the Human Rights Commission. Nobody wants a mentally ill person to have to go down that route. It's bad enough that they're in that space. The last thing we want is them to feel that that's their last resort. So choose a sensitive person and choose to have that discussion sooner than later. And we can talk more about the nature of the discussion. But I would say that sooner the better, and the right person to have the discussion is a critical part of that.
So just some really important takeaways that I think we're hearing. I think one, just as a fundamental premise going in, and Loretta, I think you really brought this out, we still talk about the workplace, and that is how we used to think about work. It was the place that you went. It's when you left the private realm and then you entered the public realm, which is your workplace. But more and more, we're really coming to understand workplaces as really just another network of relationships. And sometimes there's even overlap between those relationships, but even assume that there isn't, that your relationships at work are this self-contained set of relationships. There's a few reasons or a few context to which you can be having this discussion. But the later you have that discussion, I think what you're saying, Janet, is that the more likely that conversation is going to be about performance, like capital P performance, right? And you're in a capital P process. And at that point, we're not really doing anybody any good at that point. It's very hard once you're in those capital P processes to achieve a positive result for either the employer or the employee. So maybe initially the ideal context for those discussions is more what you were talking about, Sarah, where it's about a colleague. It's not necessarily about the hierarchy of those relationships, but that it's the one-on-one relationship that's really going to move it forward, or a knowledgeable colleague, somebody who has some literacy, some mental health literacy, who can ask the open-ended questions and just try and probe a bit about what's going on with a view to being helpful. And your chances of success are really high the earlier you have it. Now, Gina, if everyone else in this audience is like me, they really want to hear your perspective on this. I mean, you have both the clinical training, but you've also heard, I'm sure, so many stories in your practice. What's your best advice to folks thinking about the conversation at two levels, that initial kind of colleague to colleague, and then what happens when you are in those capital P processes?
Colleague to colleague, I think an ideal organization would be one where there'd be several people who I call sort of champions of mental health. So these are people who are incredibly emotionally intelligent and are able to sort of have the conversations that perhaps are more difficult for other people in the organization to have. So these people should familiarize themselves with the signs of burnout and signs of depression and signs of anxiety, because those three, either alone or in combination, are going to make up 75% of the applications for short-term disability leaves from work. Okay, so we want to catch these workplace burnout, depression, anxiety as early as possible, and how wonderful if that could be caught on a peer-to-peer level, right? That would be wonderful. And I mean, there's a variety of places that you can garner these resources. The Canadian Mental Health Association does a wonderful job of publishing literature on workplace burnout, depression, anxiety. So increasing that, I think, literacy around mental health will be important. And then taking it to the next level, so the big P processes, managers, executives at work should also be familiarizing themselves with signs of burnout because, like physical health, you want to be catching these signs as early as possible. We know that early intervention, of course, you're going to get a better outcome. And you want to retain your workforce as much as possible. In order to do that, you have to notice the signs. And then when it's time to have those conversations, the big P process conversations, always come at them from a frame of concern, right? So that the employee doesn't feel like they're being attacked or they're being signaled out. So, saying something like, I've noticed that you've taken a few extra days off this month. This is unlike you. You've come in late a few times. You're leaving a bit early. Your manager tells me that your work isn't as to your usual par. Is everything okay? What's going on? Is there anything that we could do differently to help you? Right, so start addressing the issues as early as you can catch them, but in order to do that, of course, you yourself have to be informed as to some potential red flags for workplace stress.
That is really great practical advice. And just also sort of highlighting where those areas of, we can call it mental health literacy, but it's also just human being literacy, right? Understanding behavior. And if we really want to be great talent managers, as opposed to, schedule, in charge of the time schedule or in charge of, the widget making, obviously really, understanding those signals are a big part. Sarah, I'm going to impose on you again, because when we were preparing for this discussion, you also had some really great things to say about, if you are a person with lived experience, all the positives that can really flow from speaking out and speaking out early.
Yes. So because I was I guess, maybe lucky enough. So a strange way for people who haven't been through the process to think about, but I went through my first major episode as a teenager, so I didn't have a boss yet. Instead, I had parents, and my parents have some experience with other family members who have illnesses. And they have chosen, or they're just super smart, who knows, to respect that it is a mental health issues, and especially an illness like I have bipolar disorder, is a chemical, physiological issue in my brain. It is not a choice. It is an illness like type 1 diabetes is an illness. It was predetermined that I was going to get it. And so from being 16, when my first diagnosis happened, and having my authority figures at that moment drill that into me, I don't question that. So once I started to enter the workforce, I mean, I don't walk up to people and, hi, I'm Sarah, I'm bipolar. No. But as soon as I get into a new workplace and I hit my very first hurdle, I walk in and tell my manager or whoever it makes sense to tell that this is an ongoing issue that I deal with. So from the very start, for my own self, I cut off the stigma discussion. I don't feel self-stigma, so other people have a very hard time stigmatizing me because I don't believe them. And I will have the open discussion back at them. I will, not in a combative way, but I will cut off the misconceptions before it turns into actions from those misconceptions. Now, most people with mental health issues in the workplace, as we just heard the statistics, don't handle things that way. And that's fine. That's not their experience, and that's not a judgment on them. But what it is the idea that if you do wholeheartedly disagree with stigma, whether you have an illness or you don't, become your workplace champion. Just mention it, bring it up, right? Bell Let's Talk Day. Just tweet about it, text everybody about it, bring it up at the staff meeting. The more you normalize the conversation, when somebody runs into trouble, they are less scared to speak out about it. And I think what we were talking about a bit in the discussion was at the company I was at right before I got sick, I wasn't management, I was the receptionist. But when people got into trouble, and I mean in the way that they started to feel these stresses, these burnout, the anxiety, or their girlfriend did, or their partner did, or one of their children did, which affects us just as deeply as if we were the person with the illness, they came to talk to me first. How do you handle it? How do you have this conversation? If I want to be the type of person that self-reports, where do I start that conversation? So being a leader and a mental health champion, as you discussed, is so important. You don't have to be the CEO to be the leader. You can take it upon yourself to be that person for your office, no matter where you are in the hierarchy. So
That's great. And there's a lot of literature and evidence around, just in general, one of the impacts when a workplace is inclusive and includes people with any kind of disability, it opens up so many conversations, and the workplace becomes a much more positive place to work. Because what you find out, and I think this is what you're saying with your infectious confidence, is that you discover that lots of people have lots of things going on in their life, and being able to talk about it and to negotiate it as it lines up with work is just really hugely positive for everyone. And Loretta, I thought I might impose on you to talk a little bit about it, about the issue of sort of all the positives that can flow from having these conversations at an organizational level and at a cultural level.
I just want to pick up on a couple of points because I'm so fascinated by this conversation, as I continue to have these with lots of different folks. One of the things that I observe over and over again when managers come to us and ask us, like, what am I going to do? How do I start to do this? It's for a lot of them would be they're making the assumption that the person has a mental illness before they go and have that conversation. And so this idea around, I don't know, what we'd say to them is, I don't know if the person, all I can do is have that open conversation that says, I see a change here. Let's talk about it. And so it's really difficult sometimes, I think, for managers, because they are getting training around the different kinds of mental illnesses that Gina's talking about, that they automatically make the assumption that the person is depressed or whatever. And the care and concern for many managers is overwhelming. However, the person may just be struggling with whatever, in terms of not sleeping at night, whatever that is. And so it becomes, and I think the other thing that becomes so important is that they are not trained psychologists, they're not trained mental health professionals. They are managers or they're caring coworkers or caring managers. And that goes a long ways, is what I've heard. But I think it becomes important to be clear that that's not what their role is. So their duty is to accommodate, to provide an accommodation. And I believe their role is to help people be successful in their job. And do that with what we call an MRI, which is most respectful interpretation, and with the care and compassion that's there. So I think that we have to start to shift that. I am not your caretaker, and as a manager, I'm not your parent, but I'm here to support you in whatever way I can. So the question that you asked her in terms of the impact, I can't tell you from an organizational perspective. The organizations that we've worked with that actually have put money where their mouth is, so to speak, and actually build a strategy around a mental health strategy. So it's not just a check the box. We've all been there. But the impact has been significant, that people are speaking up. People are talking. People are being accommodated in a way that they are being successful in their jobs. And whether they're going to a 3-day week, whether they take a leave, whatever that is, that their workplace is having huge impact. And we have measures around employee opinion surveys, et cetera. But just walking down the halls, we're working with one organization, and I tell you, 2 years ago, it was such a difficult place to walk down the halls. The feeling when you walk into the lunchrooms, the feelings in the staff meetings, but nobody spoke up. Lots of infighting. As they started to work with this, and it's not just around mental health, but it's around building emotional intelligence, it's building a respectful workplace, it's building one that's psychologically safe also. You walk down the halls here, and for most parts, not everywhere, it's a big organization, but for most parts, people actually are sitting down and having the face-to-face conversations. People are speaking up. And there is support that's given to people. It doesn't mean that they don't have results and they're not, delivering on their deliverables, but it's done in a way that people want to work there and people want to come to work. We know from a psychological standpoint that there's one psychiatrist that speaks up and says, my biggest test will be whether the person's paying taxes or not. So how do we get them back to work in a way that is helpful for the individual and for the organization?
That's great. And Janet, I'm going to impose on you now. One of the things that Loretta had mentioned when we were talking about why do people perceive this to be a tough conversation was the issue of time, right? So many people working really feel like they don't have time to have this conversation, or it's another thing on a list of things that they would like to do but otherwise don't have time to do. But what happens when you don't take the time early in the process, and literally what happens to your time at that point?
It's a good question. It goes to something I was hinting at earlier, and I think what you're getting at is it potentially could go into processes, lawyers, and places nobody wants to go. Back to the point where when you have these discussions early, and I think what Gina was talking about, and I think that was what were the three main problems, Gina? Was it stress? was one, burnout and
So
depression.
Workplace stress,
Workplace burnout, and
depression, and anxiety.
And so if we look at those, and again, I'm not a trained psychologist, a lot of those things may just be coming from how the workplace is structured. And so again, when you have those discussions early, it may just be a matter of understanding someone's life situation, children, childcare, parents who are sick. There are so many circumstances that can bring about those things. And so when you have that discussion early, a minor tweak is easy to have. When you don't, that person, I would assume, could just go down that road and develop those conditions more and more, and they can actually become more of a condition as opposed to just a life circumstance. And then the time that it takes to have those discussions may be a couple of hours, it may be a few hours a week, but I always tell people, have the tough discussion early, because unfortunately, when no one's talking, then all of a sudden someone's thinking, hey, they're not listening to me. No one's listening to me. And all of a sudden they do think, unfortunately, well, what am I going to do? And then they get angry. And then when people get angry, unfortunately, who do they turn to? Well, they will often turn to a lawyer. And that's when, as an organization, you may get that lawyer letter. It may not be a lawsuit. It may not be a formal complaint to the Ontario Human Rights Commission, but you get that nasty letter from a lawyer saying, my client is not being accommodated, or my client is not being respected, my client's being discriminated against. And let's remember that mental illness would be one of the grounds upon which one can be discriminated against. It's a delineated ground in the law. So that's important to remember, just as gender, religion, mental illness is a delineated ground that you can be discriminated against. So once that letter comes in from the lawyer, you've got a can of worms that's now been opened. It's a lot harder, because now you've got that me versus you mentality. That person is now angry and they're coming at you in a different way. And once that lawyer's letter comes in, you may be able to solve it there. It's a lot harder. Then, if that isn't dealt with properly, you can, as Jodi's suggesting, getting into any kind of litigation, human rights complaints. And suffice it to say, the number of hours and the amount of time, not only of one person in the organization, but of many, because once it becomes a legal proceeding, you are going to have many people in your organizations, unfortunately, involved, which from a time perspective is terrible, from an employee morale perspective is terrible, because now it's not just about that person. Now people are thinking, well, why is that person unhappy and why have they sued? We must not be doing something right here. And so it can tarnish not only that one-on-one relationship, you can tarnish an entire group and, quite frankly, an entire organization. Because as much as that may be a confidential proceeding, if that person has said to all their buddies at that organization that they're suing or they're complaining, all of a sudden everybody knows about it, and the truth of what's going on, it's like the kid's game of broken telephone. It's not going to be accurate by the time the gossip goes around to the whole organization. And then you can have an organizational toxicity. So Jodi is suggesting the time that is going to be spent by not having that conversation, or by not, getting sometimes you have to get legal advice, and I'm not advocating to do that, but this can get complicated. People can have complex conditions, and sometimes for an organization to make that half-hour call to a lawyer and get a little advice on how to deal with it up front if they don't feel trained is a half an hour of a legal bill well spent. Because at the end of the day, once you're in legal proceedings, the cost is phenomenal financially, and the cost on the organization is immense to people's productivity.
So start early, start often. I think we heard also peer champions, and as a manager, really it's part of your, basic manager role to understand the warning signs around those 4 areas, if you really want to be an effective manager. So, and Sarah, you also, talked about sort of, the personal leadership, right? If you are a person with lived experience, how transformational that can be, and the whole, like a real diverse, rich set of conversations that you had, and not all of them about mental health per se. That's a big amorphous concept to begin with, but just, all the different kinds of conversations you can have about what's happening both in and outside of that workplace that isn't a place, but a network of relationships.
I just wanted to say one quick thing, which was, hello? Yes, I have a diagnosis, but when I was telling the story of when I was the receptionist and people would come up and talk to me, none of them did. So it's not as you were mentioning, and I said earlier, there's a difference between mental health, which everybody has, and mental illness, which more people than you would think, but not everybody has. And I don't think you need to have an illness and then give all your coworkers all the gory details, like overshare. That's not necessary. But anybody can just open it up, that they are open to having the conversations. And the 1 in 5 that we've all heard, well, we have more than 5 people in most of our families. So if you're open to having the conversation, it might not be you're always talking about illness. Maybe it's just, my daughter is struggling, my father won't XYZ. It's just, when you're open to talking about this mental health issue, it doesn't have to be illness all the time. It's more just the stress, the burnout, and how do we deal with when life gets complicated.
People may be familiar with it. I certainly know the panel members would be, and many of you would be probably very familiar with it. But I have to tell you, from a personal standpoint, it was a really insightful thing for me. I've been doing this kind of work for a lot of years. Find out how we find out in terms of a family member is dealing with some severe depression. Didn't start off as severe, but one of the big ahas for me was around there's a continuum. It's a mental health continuum. That's, I don't know, Canadian Mental Health has it, Association has it on their site. The Armed Forces and Department of National Defense uses it. We do a lot of work with the feds. And it's just a color, it's 4 colors, if anybody's seen it or not, but it's a wonderful tool that starts to look from a healthy side all the way to an ill side. And what it says, and there's 4 different colors in different states. And what it did for me is I always thought that you were mentally ill or you're mentally healthy. I don't think it is that way. And it just shows you that you can move along, in terms of waking up at night and the amount of stressors that we have in our workplace and our society, and how it starts to impact it, have an extra drink, whatever that is. But it's a continuum that says, this is something that's not a discrete state. This is something in terms of stressors. A diagnosis is different, potentially, but I think that, for me, started to normalize the issue around mental health and differentiate it from the mental illness.
Yeah, I think that's really important. And Gina, I'm going to ask you to jump in just 1 second. But just if I can bring like a little levity to this, I think health in general we really need to think about it as a spectrum. You're not healthy or unhealthy. You're not mentally ill or mentally well. And my favorite way of trying to bring this home to people when I talk to them about it is how many people have heard the story of, you know what, he was perfectly healthy and then he dropped dead of a heart attack. And you're like, well, they're probably not perfectly healthy then. But that is how we think about health, right? Like, we think, just by what we see, right? What our eyes consume, we think we can judge health or lack of health. And really, all health is on a spectrum. And when you start to think about it that way, then we really then we understand that these conversations aren't tough conversations. They're actually conversations we just kind of have to have every day in different contexts with the people who we engage with around whatever those goals are, whether they're workplace goals, personal goals, volunteer initiatives, and those kinds of things, because that's part of being a good colleague. But Gina, I think you can bring that clinical perspective to this conversation that I also think is important. And I think what we heard, if we think that lack of knowledge is a barrier, if like the unknown is what makes these conversations tough, then please share some information and knowledge with us so that we can fill that void.
the idea of mental health running along a spectrum certainly reflects now what the American Psychiatric Association is doing. So if anyone's familiar with the Diagnostic and Statistical Manual of the APA, this is essentially the Bible that houses all of the possible psychiatric diagnoses that one can have. They've moved away from dichotomous diagnoses, so to your earlier point, I have depression versus not, to diagnoses that run along a spectrum. Okay, so now we're rating sort of degrees of depression as opposed to you just have it versus not, which makes sense. So thinking about degrees, I always challenge my clients, the employers that I work with, to notice the various earliest possible warning signs that one might be moving, say, further along the spectrum towards a potential diagnosis. Because with anything, of course, if you catch the signs and intervene early, you're going to be much more successful in helping your colleague, employer, friend, family, what have you. So this is in keeping with the latest research and also what clinicians are now doing. We're looking for the early warning signs, and I'd encourage you all to do the same.
That's hugely helpful. So we've talked about what an employee can do and how transformational that can be, how as a colleague, how transformational we can be by just being able to identify the signs, how it's really required reading and understanding as a manager. I'm going to ask Loretta to kick off this topic, but what is the role of the senior leader? How do we make sure that from an organizational perspective, from top to bottom and bottom to top, that we really act on what we're hearing is just a huge opportunity to have more positive workplaces?
$1 million question. A lot of senior managers, excuse my language, but suck at it. And a lot of them do a great job at it. And so the difference from what I can tell is, are they willing to have those tough conversations at the senior management table, both at an organizational strategy standpoint and at an individual standpoint? And I'm not sure where they blend, but for them not to just say we're going to do mental health training. That's what we're going to do. We're going to just put some training together, and we're going to take all our managers through it, and that's going to be it. But they're not looking at their systems and their processes and their policies. And so what I've seen in terms of a positive sense is that they have those difficult conversations in their own conversations and their own meetings, that they do speak up, that they do talk about their own vulnerabilities, which is a really difficult thing for a manager, for anybody, for any of us to talk about, is how I'm feeling vulnerable. Or that they use themselves, if the stats are 1 in 5, that around that senior management table of 8 people, they are going to have some impacts. That's mental health and mental illnesses are going to be impacting them, to be able to be the champion for the discussion. So I think that is a big part of it, is to really help the senior management team come together to have the conversations that they need to have to begin with, address what they call as the elephant in the room, and then start to look at the process, the policies. And to have, for one organization, what they did is they did a lot of videotaping, whether it was a union rep, whether it was an employee, whether it was a senior manager, and use that as a way to send the message on top of everything else. That's kind of kicked it off. But I think that becomes such an important thing, is that is probably the most difficult thing that we deal with in organizations, is to bring the senior managers together to say, this is a real issue. It's huge. It has huge implications.
Janet, what's your best advice to senior leaders?
It's not necessarily from a legal perspective, but just having worked in this space so much, I think senior leaders are often, they often bury their heads in the sand, and I think what Loretta was saying is true, that they just want to pretend that everybody's going to come in and everybody's going to come in as a perfectly balanced, happy individual and do their work. And so when they crunch their numbers and when they have their MBOs, when they have their plans for the year, it really assumes that everyone walking in the door and all the numbers they've got and the hours they're going to be put in is working at full steam. And I think that there's a lack in psychological, training, but just a lack of understanding. And I'm probably going into a realm I shouldn't here, but I'm going to suggest that there's sometimes gender biases in management. Men and women have very different issues to contend with when they come into the workplace. And I'm going to suggest that now that women work, and I've had a number of colleagues, I've got children myself, that's a big part of this. It's not something we've really talked about. I'm not going to focus on it. But I think we all come in with our own unique package of issues, and I think management needs to really be an accommodating workplace, not just for people who get even onto the spectrum of having any kind of mental health or mental wellness issues. As an organization, managers really need to say, are we allowing people to come in, and are we being flexible? Are we saying to someone who's got childcare issues or emergencies, are we going to work to help that person out and let them feel comfortable? And that person is going to come back and love us as an employer. And I've seen that in various organizations. Are we doing something so that if people have a sick parent, sick child, are we going to accommodate that? And that's going to even stop someone from getting onto that spectrum. It takes a little extra time, a little extra thought as an organization to be truly that flexible, caring organization. But if that becomes a corporate culture, it's unbelievable how that transforms an entire organization. So that's what I would say to managers. Really look at your workplace and ask yourself if there's room for people to have the daily problems and issues that we all do with double working families in that mode. And on a totally unrelated note, but something that's very important for management to understand, and if they still don't want to understand that, there's a big risk these days with social media, and something I've seen is disgruntled employees now have a very powerful way to do a lot of damage to an organization, and social media is very powerful. And once that person decides to start tweeting or Facebooking or putting out messages about the organization or going onto other social media sites and complaining about that organization as one that's not accommodating or one that is not listening, that's a big issue. So an organization at management has to think about that and think about making people as happy as possible, because if you tell your management the risk is someone going out there and bad-mouthing the organization, you can call as many lawyers as you want. Once that starts, it's a very hard thing to contain. It's not just a little lawsuit in a courtroom that really few people are going to hear about. So those would be the two things that I would add to that thought.
Yeah, I just picking up on what you said, I think it's hugely important too. I think elder care, child care, and self-care, I mean, we can all be allies in this room around those three things. So even if we're not thinking about the 1 in 5 and say, no, you know what, I am that Canadian who actually knows nobody with a mental health or addiction challenge. Okay, maybe you are, but you must know somebody who's caring for children or elders or who needs some other element of self-care. And, if we can make room for those triumvirates, those three like really essential elements of life, then I think workplaces will only become more productive, increased loyalty, and people can really give their best, right? Because somebody's best, 75% of the quantifiable hours is actually way better than the 20% over the ticking the box, the 40 hours a week, right? Because our talents are limitless, and there's so much there's just such a great chance for progress and prosperity there. Gina, what's your advice to those senior leaders? How do you really action this culture change?
Well, I know some of the senior leaders, executives I've spoken to have cited cost and time and resources as barriers to implementing mental wellness programs at work. And what I tell them is, the cost of decreased productivity related to not only mental illness, but mental health related issues, so stress, burnout at work, etc., right now equates to $51 billion a year in Canada. I mean, if you just think about that, that's an astounding number. Today, there are 500,000 people in Canada who are not at work because of a mental health or mental wellness related issue. So I have senior leaders, executives sort of think about this the other way and don't think about what it's going to cost you to implement these programs, but think about what it's going to cost you not to implement them, because that is by far the greater cost. People are the greatest resource, and you have to invest in your people if you want your organization to run healthily and efficiently. So I think once sort of you have them consider the costs of not investing, usually that at least opens the conversation and a greater willingness to do so.
So Sarah, no pressure, but pretend there's, but pretend there's a CEO sitting across from you, and she has just said what Gina has just said. You know what? I don't have the time or the money, and nor do any of my senior managers, to spend time on this stuff. What do you say to her?
Ooh. I would probably pick up on a word that you said specifically, but I think everyone has touched on in their own way, which is loyalty. And I'm not talking about like statistics on retention or you'll have fewer people quit, or I'm not talking about that. I'm talking about if a senior manager or someone at the partners table or the VP table, whatever it is, takes on that role as the champion we were talking about, and then someone gets sick or someone goes through a very difficult time in their life, as I've said, not necessarily a diagnosis, but they start to need these mythical accommodations, whatever those might be. And someone at a high level stands up for that person. They're not a statistic. They're not someone down there at the reception desk needs to not come in on Fridays. Meh. Well, no, but someone at the high level accepts it and champions it and says it's legitimate and it's true and it's the right thing to do. Not only that employee, but the rest of your employees will follow that person over a cliff, because they know that in their 40 years of working life, we're all gonna run into something. And at a certain point, we're gonna need a sick day, whether that's physical or mental, or a child is gonna get sick, or an elder is gonna get sick, and we're gonna need help. And that person, whether it's Jodi or it's, Vice President Jeff, whoever it is, that's the guy that they're gonna follow. So I think leadership is going to get this huge productivity numbers out of your people, and it's not numbers. It's the fact that you give them a day, and they'll come back and they'll reward you for it 1,000 times over. So I think it's worth it, is what I would say.